Breaking news tonight on a growing health concern in the Midwest, where a new study reveals a disturbing trend in the Windy City. Researchers in Chicago have found that rates of sensitization to outdoor allergens have skyrocketed in the years following the COVID-19 pandemic, with alarming increases in sensitization to tree pollen, weed pollen, grass pollen, and mold. The study's lead author says the findings may be linked to the changing climate, with warmer temperatures and increased rainfall contributing to the proliferation of these allergens. We'll have more on this developing story and what it means for those living with allergies. As we delve into the complex world of allergic diseases, it is essential to understand the fundamental concept of allergic sensitization. This process is a critical step in the development of allergic reactions, and it involves the body's immune system responding to the presence of allergens in a way that is disproportionate to the actual threat posed by these substances. At the heart of allergic sensitization lies the phenomenon of immune cell activation. When an allergen enters the body, it is recognized by immune cells, such as dendritic cells and T cells, which then become activated and begin to proliferate. This activation is mediated by a complex interplay of signaling molecules and cytokines, which ultimately leads to the production of antibodies. Antibodies are proteins produced by B cells that are specifically designed to bind to the allergen, marking it for destruction. However, in individuals with allergic sensitization, these antibodies are not simply neutralizing the allergen, they are also amplifying the immune response, leading to the release of histamine and other chemical mediators that cause the characteristic symptoms of allergic reactions. One of the key features of allergic sensitization is the concept of immune memory. Once an individual has been exposed to an allergen and has developed antibodies against it, their immune system retains a memory of this exposure, allowing for a rapid and exaggerated response upon subsequent encounters with the same allergen. This process of immune memory is thought to be mediated by a subset of T cells known as memory T cells, which are able to recognize and respond to specific allergens even in the absence of the original antigen. This is why individuals with allergies often experience a rapid and severe response to even small amounts of the allergen, as their immune system is able to mount a pre-existing response that is disproportionate to the actual threat posed by the allergen. In conclusion, allergic sensitization is a complex process that involves the activation of immune cells, the production of antibodies, and the development of immune memory. Understanding this process is critical for the development of effective treatments and prevention strategies for allergic diseases, and it highlights the importance of continued research into the underlying mechanisms of allergic sensitization. The study in question employed a retrospective chart review methodology to analyze changes in pollen patterns over the past 10 years in Chicago. This approach involved the systematic examination of existing medical records to identify patterns and trends in patient data. The researchers collected data from a cohort of patients with nasal allergies who had undergone blood testing and had their patient-specific characteristics recorded in their medical charts. The study population consisted of 1,052 patients who were divided into two groups: those who underwent blood testing between 2014 and 2019, pre-COVID period, and those who underwent blood testing between 2022 and 2024, post-COVID period. The researchers used a standardized data collection tool to extract relevant information from the medical records, including patient demographics, allergy history, and blood test results. The data were then analyzed using statistical software to identify trends and patterns in the pollen sensitization rates over time. One of the key strengths of this study was its use of a large and diverse patient population, which allowed the researchers to capture a broad range of pollen sensitization patterns. Additionally, the study's retrospective design enabled the researchers to examine changes in pollen sensitization rates over a prolonged period, providing valuable insights into the long-term effects of climate change on pollen production and human health. The researchers also employed a robust data analysis strategy, which included the use of statistical models to control for potential confounding variables and to identify independent associations between pollen sensitization rates and climate change indicators. This approach helped to ensure the validity and reliability of the study's findings and provided a high degree of confidence in the results. Overall, the methodology used in this study provides a powerful example of how retrospective chart review can be used to investigate complex questions in medical research, and highlights the importance of using robust data analysis strategies to ensure the validity and reliability of study findings. The study's findings provide a compelling narrative of the impact of climate change on pollen production and human health. The researchers observed a significant increase in sensitization to outdoor allergens in the post-COVID period compared to the pre-COVID period, with a notable rise in sensitization to tree pollen, weed pollen, grass pollen, and mold. Notably, the study found that sensitization to tree pollen increased by 20.5% from 49.3% in the pre-COVID period to 69.8% in the post-COVID period. Similarly, sensitization to weed pollen increased by 21.8% from 54.1% to 76.1%, while sensitization to grass pollen rose by 42% from 57.7% to 100%. Perhaps most strikingly, sensitization to mold increased by 30.2% from 46.5% to 76.7%. These findings suggest that the changing climate is having a profound impact on pollen production, with increased temperatures and changing precipitation patterns leading to longer and more intense pollen seasons. The study's results also highlight the need for increased awareness and preparedness among individuals with allergies, as well as the importance of continued research into the effects of climate change on human health. Furthermore, the study's findings have significant implications for the development of effective treatment and prevention strategies for allergic diseases. By understanding the specific patterns of sensitization to different types of pollen, healthcare providers can develop targeted interventions to mitigate the effects of climate change on human health. The study's results also underscore the importance of interdisciplinary collaboration between researchers from fields such as immunology, ecology, and public health. By working together, we can better understand the complex relationships between climate change, pollen production, and human health, and develop effective solutions to address the growing burden of allergic diseases. The study's findings suggest that the increased sensitization to outdoor allergens is likely due to the changing patterns of pollen and mold proliferation, secondary to increased temperatures, rainfall, and rising CO2 levels due to climate change. Research has shown that warmer temperatures and changing precipitation patterns can lead to an increase in pollen production, as plants are able to grow and produce more pollen in response to the changing climate. This, in turn, can lead to an increase in sensitization to outdoor allergens, as individuals are exposed to higher levels of pollen. Furthermore, the study's findings suggest that the increased CO2 levels in the atmosphere may also be contributing to the increased sensitization to outdoor allergens. CO2 is a key component of plant growth, and increased levels of CO2 can lead to an increase in plant growth and pollen production. The changing patterns of rainfall may also be playing a role in the increased sensitization to outdoor allergens. Research has shown that changes in rainfall patterns can lead to an increase in mold growth, as the increased moisture in the air provides an ideal environment for mold to grow. The study's findings also suggest that the increased sensitization to outdoor allergens may be due to the synergistic effects of multiple climate change factors. For example, the combination of warmer temperatures, increased rainfall, and rising CO2 levels may be leading to an increase in pollen and mold production, which in turn is leading to an increase in sensitization to outdoor allergens. It is also possible that the increased sensitization to outdoor allergens is due to the increased exposure to allergens that individuals are experiencing as a result of climate change. As the climate changes, individuals may be spending more time outdoors, which can lead to an increase in exposure to allergens. Overall, the study's findings suggest that the increased sensitization to outdoor allergens is likely due to a combination of factors, including the changing patterns of pollen and mold proliferation, secondary to increased temperatures, rainfall, and rising CO2 levels due to climate change. The study's findings have significant implications for public health, as they suggest that the changing climate may be exacerbating allergy symptoms and increasing the burden of allergic diseases. The increased sensitization to outdoor allergens, particularly tree pollen, weed pollen, and grass pollen, may lead to a rise in respiratory allergies such as asthma and rhinitis, which can have a significant impact on quality of life and healthcare costs. Furthermore, the study's findings highlight the need for further research to investigate the relationship between climate change and sensitization patterns to pollens. As the climate continues to change, it is essential to understand how these changes will impact pollen production and sensitization patterns in order to develop effective strategies for mitigating the effects of climate change on human health. One potential area of research is the development of early warning systems for pollen production and sensitization patterns. By identifying areas with high pollen production and sensitization rates, healthcare providers can prepare for and respond to potential allergy outbreaks, reducing the burden on healthcare systems and improving patient outcomes. Another area of research is the investigation of the impact of climate change on the distribution and prevalence of allergenic plants. As the climate changes, some plants may become more or less prevalent in certain regions, leading to changes in sensitization patterns and allergy symptoms. Additionally, the study's findings highlight the need for increased awareness and education among the public about the potential impacts of climate change on allergy symptoms and sensitization patterns. By educating individuals about the risks and consequences of climate change, we can empower them to take steps to mitigate these effects and reduce their exposure to allergens. Finally, the study's findings emphasize the importance of interdisciplinary collaboration between researchers from fields such as immunology, ecology, and public health. By working together, we can develop a more comprehensive understanding of the complex relationships between climate change, pollen production, and human health, and develop effective strategies for mitigating the effects of climate change on public health. While the study provides valuable insights into the relationship between climate change and sensitization patterns to pollens, it is essential to acknowledge the limitations of the study. One of the primary limitations is the reliance on retrospective chart review, which may be subject to biases and limitations in data collection and analysis. Retrospective chart review involves examining existing medical records to identify patterns and trends in patient data. However, this approach can be limited by the quality and completeness of the data, as well as the potential for selection bias and information bias. For example, the study may have been limited by the availability of data on pollen exposure and sensitization patterns, which may have been incomplete or inaccurate. Additionally, the study may have been subject to selection bias, as patients with more severe or complex allergies may have been more likely to be included in the study. Furthermore, the study's reliance on a single data source, namely the medical records of patients with nasal allergies, may have limited the generalizability of the findings to other populations. The study's results may not be representative of the broader population and may not be applicable to individuals with different types of allergies or sensitization patterns. Another limitation of the study is the potential for bias in the data analysis. The study's authors may have been influenced by their own biases and assumptions, which could have affected the interpretation of the data and the conclusions drawn from it. For example, the study's authors may have been more likely to identify relationships between climate change and sensitization patterns that were consistent with their pre-existing hypotheses or assumptions. This could have led to an overestimation or underestimation of the relationship between climate change and sensitization patterns. In conclusion, while the study provides valuable insights into the relationship between climate change and sensitization patterns to pollens, it is essential to acknowledge the limitations of the study and consider the potential biases and limitations in the data collection and analysis. Future studies should aim to address these limitations and provide more robust and generalizable findings. Climate change is a complex and multifaceted phenomenon that is having a profound impact on the Earth's ecosystems, including plant vegetation patterns and pollen production. At its core, climate change refers to the long-term warming of the planet due to the increasing levels of greenhouse gases in the atmosphere, primarily carbon dioxide, CO2, which is released through human activities such as burning fossil fuels and deforestation. One of the key drivers of climate change is the increase in global temperatures, which is altering the timing and intensity of pollen seasons. Warmer temperatures are allowing plants to grow and produce pollen earlier in the season, which can lead to an increase in pollen production and sensitization patterns. This is particularly concerning for individuals with allergies, as it can lead to an increase in symptoms and severity. Rainfall patterns are also being altered by climate change, which can have a significant impact on plant vegetation patterns and pollen production. Changes in rainfall can lead to an increase in moisture in the air, which can promote the growth of plants and increase pollen production. This can be particularly problematic for individuals with allergies, as it can lead to an increase in symptoms and severity. The increase in CO2 levels in the atmosphere is also playing a critical role in altering plant vegetation patterns and pollen production. CO2 is a key component of plant growth, and increased levels of CO2 can lead to an increase in plant growth and pollen production. This can be particularly concerning for individuals with allergies, as it can lead to an increase in symptoms and severity. The impact of climate change on plant vegetation patterns and pollen production is not limited to the timing and intensity of pollen seasons. Climate change is also altering the types of plants that are growing in different regions, which can lead to an increase in the production of allergenic pollen. For example, the warmer temperatures and changing rainfall patterns are allowing plants such as ragweed and grasses to grow in areas that were previously too cold or dry for them to thrive. In conclusion, climate change is having a profound impact on plant vegetation patterns and pollen production, with increased temperatures, rainfall, and CO2 levels altering the timing and intensity of pollen seasons. This can lead to an increase in symptoms and severity for individuals with allergies, and highlights the need for further research into the impact of climate change on plant vegetation patterns and pollen production. The findings of this study are consistent with previous research on the impact of climate change on pollen production and sensitization patterns. Studies have shown that climate change is leading to an increase in pollen production and sensitization patterns, particularly in regions with warmer temperatures and changing rainfall patterns. One study published in the journal Environmental Health Perspectives found that climate change is leading to an increase in pollen production and sensitization patterns in the United States, particularly in the Midwest and Southeast regions. The study found that the number of people with allergies is increasing, and that the severity of allergy symptoms is also increasing. Another study published in the journal Allergy found that climate change is leading to an increase in pollen production and sensitization patterns in Europe, particularly in the UK and Germany. The study found that the number of people with allergies is increasing, and that the severity of allergy symptoms is also increasing. In contrast, this study found that the impact of climate change on pollen production and sensitization patterns is not uniform across different regions. The study found that the impact of climate change on pollen production and sensitization patterns is greatest in regions with warmer temperatures and changing rainfall patterns, such as the Midwest and Southeast regions of the United States. Furthermore, this study found that the impact of climate change on pollen production and sensitization patterns is not limited to the timing and intensity of pollen seasons. The study found that climate change is also altering the types of plants that are growing in different regions, which can lead to an increase in the production of allergenic pollen. In conclusion, the findings of this study are consistent with previous research on the impact of climate change on pollen production and sensitization patterns. However, this study highlights the need for further research in this area, particularly in regions with warmer temperatures and changing rainfall patterns. Further research is needed to understand the impact of climate change on pollen production and sensitization patterns, and to develop effective strategies for mitigating the effects of climate change on human health. It is also worth noting that the impact of climate change on pollen production and sensitization patterns is not limited to the medical field. Climate change is also having a significant impact on the economy, particularly in regions with high levels of pollen production and sensitization patterns. For example, a study published in the journal Environmental Health Perspectives found that the economic impact of climate change on pollen production and sensitization patterns in the United States is estimated to be in the billions of dollars. In conclusion, the findings of this study highlight the need for further research in the impact of climate change on pollen production and sensitization patterns, and the need for effective strategies to mitigate the effects of climate change on human health and the economy. The study's findings have significant implications for the development of new treatments and prevention strategies for allergic diseases. The increasing prevalence of allergies and the impact of climate change on pollen production and sensitization patterns highlight the need for innovative and effective solutions to mitigate the effects of these changes. One potential area of research is the development of targeted interventions to reduce the impact of climate change on pollen production and sensitization patterns. For example, researchers could explore the use of genetic engineering to develop plants that produce less allergenic pollen or that are more resistant to the effects of climate change. Another potential area of research is the development of new treatments that can effectively manage allergy symptoms and prevent the development of allergic diseases. For example, researchers could explore the use of immunotherapy, which involves the use of small amounts of allergen to build up tolerance and prevent allergic reactions. The study's findings also highlight the need for a more comprehensive approach to allergy prevention and treatment. This could involve the development of public health campaigns to raise awareness about the impact of climate change on allergies and the importance of taking steps to prevent and manage allergic diseases. Furthermore, the study's findings suggest that a more personalized approach to allergy prevention and treatment may be necessary. This could involve the use of genetic testing to identify individuals who are at high risk of developing allergic diseases, and the development of tailored treatment plans to address their specific needs. In addition, the study's findings highlight the need for further research into the impact of climate change on pollen production and sensitization patterns. This could involve the use of advanced technologies such as satellite imaging and machine learning to monitor pollen production and sensitization patterns in real time and to identify areas where interventions may be needed. Overall, the study's findings have significant implications for the development of new treatments and prevention strategies for allergic diseases. By exploring new areas of research and developing innovative solutions, we can work towards a future where allergies are better managed and prevented, and where individuals can live healthier and more fulfilling lives. The American College of Allergy, Asthma, and Immunology, ACAAI, plays a vital role in promoting research and education on allergic diseases. As a leading professional organization in the field of allergy, asthma, and immunology, the ACAAI is dedicated to advancing the understanding and treatment of these conditions. One of the key ways in which the ACAAI promotes research and education is through its annual scientific meeting, which brings together leading experts in the field to share their latest research and findings. The meeting provides a platform for researchers and clinicians to present their work, discuss the latest developments in the field, and collaborate on new research projects. In addition to its annual meeting, the ACAAI also provides a range of resources and guidance for individuals suffering from allergies, asthma, and immunological disorders. The organization's website offers a wealth of information on these conditions, including symptoms, diagnosis, treatment options, and lifestyle tips for managing allergies and asthma. The ACAAI also provides a range of educational programs and resources for healthcare professionals, including online courses, webinars, and workshops. These programs are designed to help healthcare professionals stay up to date on the latest developments in the field and to provide them with the knowledge and skills they need to effectively diagnose and treat allergic diseases. Furthermore, the ACAAI has a strong commitment to advocacy and public awareness. The organization works to raise awareness about the importance of allergy and asthma research and to advocate for policies that support the needs of individuals with allergic diseases. The ACAAI also has a number of initiatives aimed at promoting diversity and inclusion, in the field of allergy, asthma, and immunology. The organization recognizes that allergic diseases affect individuals from all backgrounds and that there is a need for more research and education on the impact of these conditions on diverse populations. In conclusion, the American College of Allergy, Asthma, and Immunology plays a critical role in promoting research and education on allergic diseases. Through its annual scientific meeting, educational programs, and advocacy efforts, the ACAI is working to advance the understanding and treatment of these conditions and to improve the lives of individuals affected by them.
Technical summary. This presentation has provided an in-depth examination of the relationship between climate change and allergic diseases, with a focus on the impact of climate change on pollen production and sensitization patterns. The study's findings have significant implications for the development of new treatments and prevention strategies for allergic diseases and highlight the need for further research in this area. The presentation has also highlighted the role of the American College of Allergy, Asthma, and Immunology, ACAAI, in promoting research and education on allergic diseases, including the organization's efforts to provide resources and guidance for individuals suffering from allergies, asthma, and immunological disorders. In conclusion, this presentation has provided a comprehensive overview of the relationship between climate change and allergic diseases, and has highlighted the need for further research in this area. The study's findings have significant implications for the development of new treatments and prevention strategies for allergic diseases, and the ACAAI's efforts to promote research and education on allergic diseases are a critical step towards advancing our understanding and treatment of these conditions. Product of Intellect Cascade. This content is the product of Intellect Cascade, a research product of Big Blue Ceiling. Intellect Cascade is a cutting-edge research platform that utilizes advanced artificial intelligence and machine learning algorithms to analyze and synthesize complex data sets, providing insights and recommendations for a wide range of applications. Big Blue Ceiling is a leading provider of research and development services with a focus on advancing the understanding and treatment of complex diseases.